Hi everyone, I'm Dr. Bhawana Mishra here, and I'm here to actually alleviate one of your most common fear that my patients have once they know that they are pregnant. So as soon as you've missed your period and you've done this little urine test at home and it's come positive, you come to us. Of course, the first thing that we want to know is whether this pregnancy is intrauterine or not. There is a small chance, as most of you are aware, that the pregnancy can also sit outside the uterus, in the tubes, or say in the ovaries. This is of course not very common, but it can give rise to a lot of symptoms that can overlap on the common pregnancy symptoms. And the ectopic pregnancy cannot be taken any further. There will be a rupture and there'll be a lot of bleeding inside, so we need to know. And so the first thing that we tell you is to do a scan. And as soon as we mention about scan, people get cold feet. They're like, is it going to harm, my baby and my pregnancy? So here I am to talk about this problem. The first few scans generally are a vaginal scan. That's when we get the maximum clarity to see inside and have a look at things in detail because of its proximity to the uterus. Now, to tell you that whether vaginal scan or abdominal scan, which we do later on from the 3rd month onwards, is not at all harmful for your pregnancy. Say if your mothers or grandmothers tell you that we never had it, that's because this very technique was not there. Don't all of us use a smartphone these days and, not the age-old kind of phones that we used to have earlier. So this is just a new thing in our lives, and trust me, it has made both our lives and your lives a lot more easy. It is like having an eye inside the womb and to see every little thing in detail. Now, also to know and to realize that ultrasound scan is not something where you are exposed to some kind of a radiation, like say a X-ray, which we know is harmful during pregnancy. Now, when you come the first time, we do this thing to see a uterine gestation, then sometimes to see the number of pregnancies, that is it a singleton pregnancy or are you having a twins or triplets or what? So it also tells us about that. Close to about 6 to 8 weeks from your last periods, we will also get to hear the baby's heartbeat. So generally by this time, the baby's heartbeat is very much seen. And this is when you diagnose a good heartbeat beating and you show it to the patient. This is a viability scan. Now the other 2 scans that we do generally are the 3rd month scan or the NT scan. NT stands for nuchal translucency. And the 5th month scan, which is a general anomaly scan to rule out any structural abnormalities in the baby. The 3rd month scan is let's say roughly a genetic scan. So it reads the baby's spine and the nuchal thickness, like what we were talking about, nuchal translucency, and that goes to tell us to a large extent whether the baby is genetically sound or not. And this is of course coupled with another blood test that we have. It's we call it double marker. So both these tests together, it forms the combined test. The 5th month scan is the most important scan. It's the anomaly scan wherein each structure of the baby is studied in detail, like the brain, the heart, the kidneys, and many a times we come across a small little deviation from the normal, which is termed as a soft marker, and so we help you manage this pregnancy and tell you about what is the exact situation. Post this 5th month scan or the anomaly scan, we can have a few growth scan anywhere between 28 to 34 weeks. So if you clinically suspect some kind of a that the growth is not so proper, we subject you to this a little early. There can sometimes be a little serial kind of growth scans. Say if you have come to know that the liquor around the baby is less, or say the blood flow, or you suspect some kind of a problem there. Now, in between the routine scans, say if you experience bleeding during period, so you're worried about what's going wrong, and then also through a scan we can read about whether there's a hemorrhage there or a clot sitting or what next. So these are all add-on things depending on your symptoms. But the routine thing, like I said, the 5th month scan and the growth scan, And maybe towards the very end, just before you're going to deliver, we can do your end term scan, which is which measures a lot of things like, again, the position of the baby, whether the head is down or not, or is it in the proper kind of thing for a normal delivery. Is there a loop of cord around the neck? Is the water content all okay? How's the blood flow? How's the gross baby movement and all that? And we give a score called BPP, or it's called a biophysical scan. So these are the routine things that we do. And in a very, very few cases, we need to do very close monitoring. Say if there is some uncontrolled sugar or uncontrolled hypertension during pregnancy, or for that reason cholestasis, which is wherein you have elevated liver enzymes. So these things need more a vigilant kind of watch, and we may have a few more scans. But it really does not affect your pregnancy. It only goes to tell you about the exact condition of your fetus and yourself. So nowadays we that we exactly know how much would this expected weight of the baby be and such things. And we also anticipate sometimes a difficult delivery. Say if there are a lot of 3-4 loops of cord around the baby's neck, then we are a little more vigilant during your delivery. So I think that brings us to the end of this talk. Just to let you know that ultrasound in pregnancy is totally safe.